A good day to all of our English-speaking members of our community. It's been a long time since I've spoken to you. My apologies for that. I'll try to make it better. I want to talk to you about a couple of things, about what is the state of affairs in Curaçao now in relation to COVID-19, what's the story about the measures that we're taking and keeping in place or not, and what additional issues have been taken care of in these coming days. Lots of you are wondering about other parts of the United States, are they open or not, etc. So let's get down to business. I'm going to do this, I'm going to show you a couple of graphs. The graphs are since last week. Some things have changed in terms of they've gotten better, but I think I can explain it to you with these graphs and that you'll get a decent picture. This is what we call the epi curve. What you see in the graph are the blue bars are the amount of positive cases on a daily basis, and the red curve depicts the 7-day moving average. Without getting too technical, you can clearly see that you've been over a summit, a peak in the amount of cases per day, and that we're in the downward part of the curve, which is a good thing in itself. And this is an effect, this is the reason why seeing it going up, first of all, that was the reason why we had to take additional measures in terms of curfew, in terms of taking certain measures that were all geared towards limiting the big groups of people getting together, trying to limit the possibilities of you not being able to keep distance from one another, because these are the most important measures to be taken when you're talking about COVID. So you see that the epi curve is looking good. We're not there yet. What you need to be afraid of, certainly in these times, when it's Christmas, holiday season, New Year coming up, we're used to having parties, social gatherings, lots of people. That can easily turn up into a new upsurge of cases. And that's what we need to avoid, because if that happens, we're going to put a lot of stress on the healthcare sector, and then we're going to have more people in the hospital and people in intensive care with all kinds of problems. So that's the reason why, although the figures are going in the right direction, we're not there yet. We know that this period in time is problematic and lends itself to create gatherings in places that are exactly those that we want to try to avoid because of COVID. That's why we need to keep the measures in place. Let me show you another graph. This is something that we've been talking about also a couple of times. This depicts the positivity rate. The blue bars, they represent the total amount of tests that were taken on any given day. The red bars, lower than that, they represent the amount of positive tests among those. And the gray line, the gray graph that you see throughout that, that is the percentage of positives on a daily basis of the total amount of tests taken on that day. And ideally, we'd like to be under the 5%, which it was a couple of months ago. We're far under the 5%. But this is why you need to take into account. You can see here at the top of the curve, we were close to 25% positivity rate. That's way too high. If this is supposed to be representative of what's going on in society, it cannot be that 25% of your population is infected with COVID at any given time. That would be way too high. You would have to see that in the hospital as well. So that's an indication that there may be out there cases that it is higher than you think. And if you want to see for sure that if that's so or not, you need to test more, because you know that the real positivity rate should be lower. It should be lower than 5%. So you go out and you test more. In the beginning, you will find more, because skeptics are saying, yes, you're fooling us because you're finding more because you're testing more. That's true to a certain point. That's only true in the upsurge part of the epidemic. When the epidemic is rampant, when there is widespread transmission, if I test more, I will find more cases. But the objective is to take measures that then, even if I test more, the percentage of tests that I'm taking goes downwards, and the amount that I test positive will go downwards. So even though I test more, I find less positive people. That's what you want to go to. So it's not always necessarily so if I test more, I'll find more. That's true in the upsurge part of the epidemic. So I hope to have made that clear. So you see now in the graph that the gray line is going downwards. And around now, remember this was about almost a little more than a week ago. So right now, I estimate it will be around 10% positivity rate, which as yet is too high, because ideally we'd like to have it under the 5%. Then the last thing I want to show you is our calculations of the so-called R factor, the R number. What is the R? R is a reproduction number or replication number of the virus. If you have an R that's higher than 1, it means that every person infected with COVID can infect more than one other person, and then necessarily so, your infection, your transmission rate will go up. So ideally, you want the R number to be below 1. If it's below 1, it means that every one person that is infected with COVID infects less than one other person. That means you can turn things around. That means that you're in a better part where you want to be. That means that the rate of infection is slowly but surely dying out. That's where you want to be. Right now, according to this graph, but again, this is about 9 days ago, we're around 0.8. The R is 0.8, so a couple of decimal, 0.2 below than 1, which is good. We'd like to have it lower than that. So we have to keep on keeping those measures in place that will guide us towards less agglomeration of people, more possibilities of keeping distance, because again, those two are the most important things that we can do. And especially also in this period of time, whatever you do, wherever you go, remember to take care of your elderly, of those more vulnerable who have maybe problems with their immune system, that they're taking medicines that affect their immune system, or they have illnesses that affect the immune system. They are people who are more prone to get severe disease. So those are the groups of people that we have to try to protect as much as possible. Anyway, because of the holiday season, we know that that is the time that we like to get together. This is the reason why, although things are looking better, we cannot relax on the measures now, because if we do that now, I guarantee you there will be an upsurge. And that upsurge will be more difficult to control. So we need to keep up the measures a little bit longer to get us in an easier, in a safer zone, where after the holiday season we can relax that a little bit. Of course, whenever vaccination takes place inside, that will help. It will help you to protect the vulnerable groups. And once you think you have those protected, you will never have enough vaccine to vaccinate the entire population of Curaçao. But we have to look forward to try to, in any case, protect those groups of people who have a higher risk of getting severe disease. So again, the group of elderly, people with chronic disease, people who have immune problems, or have an impaired immunological system. These are the groups that we need to try to protect, and possibly also essential workers, such as healthcare workers, to try to be able to cover that we won't get into problems with our healthcare facilities if that ever takes place. So until that day, we still need to do our utmost to try to protect the vulnerables, barring having a vaccine in place. What else are we doing? Yes, the question you're all sitting with, what about if I have people that don't live in the tri-state area or in Florida, can they come to Curaçao? Yes, as of January 1st, there is no need anymore to ask for a permit. People can come in. We changed our risk classification countries in 2. It's now low risk and high risk. We're high risk, no more quarantine, no permits, but you do need a PCR beforehand, and you do have to fill out the passenger location card. Why can we do this? Because we know now with experience that PCR prior to coming in does lower your risk in between 70 to 80%. And we also know that the spread locally doesn't take place solely because of tourists or people coming in, but we're taking care of the spread quite nicely ourselves. So we have to look at the measures that we take, but we have to allow for free movement, and we have to allow for our economy to at least come do part of its work, because if not, the consequences also on public health effect would be long-lasting and more severe. So we need to create that balance, allowing things to taking place, still maintaining certain measures to avoid us from becoming into a bigger problem later. So this is what we're doing. It amounts to that smaller islands in our surroundings, they are lower risk. We look at different outcome values. We look at the positivity rate. We look at the daily amount of cases, the moving 7-day average. We also look at how secure, how safe are the data, so how sure are we that they're correct. And we're also looking at the total population amount. So the bigger the country, of course, the bigger chance you have that there are more absolute numbers. So we're looking at that as well. So basically it comes down to smaller islands in our surroundings, low risk. Anybody who's not on the low risk list is considered high risk, but high risk these days, as of January 1st, means no asking of permit, but you do need a PCR in advance, and then you can come to Curaçao. So I hope this is clear. I hope it's clear why that's possible, because it doesn't mean that we don't take any measures locally anymore, but we are trying to make it easier for the flow of people coming in and going out to take place, to continue to take place, but as safe as possible manner. Remember, COVID is out there. The entire world has it. It's coming in waves, it's going up, it's going down. So it's there, it's not going to go away. There will never be enough vaccine to cover everybody. And we can't keep doing this. We can't keep closing up, opening up, more restrictions, lower restrictions. We need to move towards a more rational approach, how we deal with these things. If already now we know by experience that the PCR in advance does cover a big part of the risk, then we'll go with that flow. We'll try to take measures locally to try to make movement possible, but at a safe as possible way for the country as well. So I hope you had a happy holiday with Christmas, and I wish you all a very good, happy, healthy, prosperous New Year. Thank you very much.